I found there was another rheumatologist from Hospital for Special Surgery, another Dr. Lisa, and we talked about some of the new options and research going on right now.
As a physician specializing in lupus, one of the hardest things is to help patients accept the diagnosis and understand that this is a chronic disease, that we work hard with them to control the disease as best as possible. But it's a big change for most of these patients when they're diagnosed. Lupus affects predominantly women. It's a 9-to-1 ratio, women to men, and it has its onset during the early reproductive years for the most part.
And it presents differently.
And it presents very differently. So diagnosis sometimes is delayed unless someone comes in with classic active lupus inflammation. It can take several years for someone to find their diagnosis. Symptoms can come and go, and again, as you said, they can be very variable. So it's a little bit like putting a puzzle together in terms of interpreting the symptoms, and then of course physical findings and lab tests, and we use all of that information to make the diagnosis.
And it's crucial that they get treatment quickly with every episode, right?
Absolutely. We have learned over the years that our initial treatment for lupus started many, many years ago, which was steroids, prednisone most commonly, works very well for active inflammation. But over the years, if you don't taper it and stop it, it leads to many, many side effects that really are debilitating and cause a lot of comorbidities. So we have learned, especially over the past 5 to 10 years, that we need to treat almost surgically with the steroids. Give it when it's needed in a high dose, pull back quickly, and substitute other safer immunosuppressive medicines that we have available to us. And luckily, again, over the past several years, we've had new medications approved for lupus, really for the first time in 50 years when hydroxychloroquine was first approved. So we have new medicines with safer side effect profiles that can then take the place of the prednisone and help patients to stay under control and really live their lives pretty normally in many, many cases.
Big puzzle, but there's so much hope. Coming up next time we chat, love. We're going to talk about a love connection and lupus, connecting some nice dots. Right now, though, we'll send it right back to you guys in the studio.
We look forward to it, John. Thanks as always.